share.
Greetings, everyone. It is the 6th of August, and we're delighted to have you for the PCI Community Forum. Today, we're joined by Harvey Castro. I think you'd like to call yourself the AI doctor, right? Or if you were a Marvel character, you would be Dr. AI, right? Certainly, you're bringing a lot of connectivity between the world of medicine and healthcare and these new technology tools. I think that there's more to it than AI, and you're going to read us into that. So we're delighted to have you with us. Anything else that you want to share about your current role and background, just tell us as you jump in. And I might add that Harvey is a kind of a regular on our calls, so we're not only happy to have him as a featured guest, but as a member of the community. Harvey, great to have you with us.
All right, guys. Well, first of all, thank you for having me. It's a true honor to be here and present to my colleagues and friends. And like I always say, let's have some fun. Quick little background, if you don't know about me, I'm an ER doctor, 20 years experience. I love AI, obviously, to the point where I wrote the first book on ChatGPT and healthcare back in 2022. And as I move forward, I've been blessed with being able to present around the world. I'm really excited that the country of Singapore has asked me to be an advisor for them for digital health. The Texas Medical Association, literally after coming off the stage, the president came to me and said, "We'd like you to be one of our advisors for the Texas Medical Association." And so as I'm doing this, it's both fulfilling in the sense that I get to do something fun and put my medical MD hat on and say, this is how I think we should do healthcare. And then at the same time, speak to the data scientists, because I spent a lot of time with programmers and that angle. So it's been fun. So let's get started. And for my younger population that don't know Terminator, I'm going to tell them they need to really watch Terminator.
Listen to me very carefully. That's one of my mission parameters. I'll drive. Trust me.
All right. And let's start with this deep fake.
As a patient advocate, I'm excited about the potential of AI in healthcare. I enjoy following Dr. Castro on LinkedIn.
Accurate early disease detection, groundbreaking.
This technology promises a future where care is customized to each individual's unique health profile. Keep up the good work, Dr. Castro.
Yes, predictive diagnostics within reach.
Thanks to innovation in this field, personalized healthcare is becoming accessible to all. I'm happy to see that Dr. Castro wrote the first book on ChatGPT and healthcare back in 2022.
No more injuries undetected?
Hi, as an AI researcher, I collaborate with medical experts, like Dr. Castro, to develop technologies that predict health risks, personalize therapies, and support surgical procedures. Our aim is to leverage AI to not only improve health outcomes, but also to save lives.
VideoGen AI medical imaging transformed.
The new iPhone 18 will leverage small language models. I am excited to see what applications Dr. Castro will create. He has several Apple Vision Pro applications out.
As a patient advocate,
so I always like starting with that because it is scary what we can do with AI. And just to kind of remind you, that was obviously that's a deep fake. Every slide, every image, more than likely was created with AI, and I'll point those out. And so where's the state of the union right now with healthcare? Honestly, it's all over the place. Depending on what part of the country you're in, depending how you see AI will determine exactly how AI is used at your institute. Obviously, if we were in Silicon Valley and in California, we're going to be seeing certain things that are going to be used a lot more acceptable because the culture is different. I literally just got off the call from this meeting, and I found out that Sanford got 100 H1 chips, and they're having their own AI lab. And I'm thinking, wow, if they have that lab, they're going to put some a portion for just medical. I can't imagine the stuff that they're going to be creating. And so this is the one slide that really gets me passionate about ChatGPT and healthcare. And some of you guys have heard me spoke before, and this is the one that I always use, but it really drives the message. Number one, there's this poor little kid. He went to see 17 doctors for chronic pain. And over a 3-year period, the mother just was relentless, trying to figure out what was wrong. And one of the doctors had the audacity to tell the mom, "Hey, this is all in his head. Nothing's wrong with your kid." And that poor kid had this horrible leg pain, and just, it just broke my heart hearing this story. But the mom went to ChatGPT, took all the medical records, took all the MRIs, fed it into ChatGPT and said, what could possibly be wrong with my kid? Fast forward, AI actually said, ChatGPT said, this could be tethered core syndrome. And so then she went back to the neurosurgeon and said, look, AI is telling me it's possibly this syndrome. He went back, looked at the MRIs and said, oh my gosh, I see it. Yes, there is a spot here that is tethered core syndrome. And so with that, it just really drives the message like we need something to help us with our healthcare system. As we look at the different models that are out there, it comes in different flavors and different sizes. Obviously, everybody's heard of ChatGPT. People are now hearing about Gemini and Claude. Big picture, different sizes for different tasks, different goals. But the number one thing that I want to mention here is when we look at these models, some of them, their IQs are different from others. So as you can see in this diagram, the human being here, average, is showing an IQ of 120. And as you look to the diagram to the right, you start noticing that these models are getting better and better. Their IQ is getting higher and higher. And now we're getting to a point where you see here, it says a PhD and then possibly more. And then I'm thinking as a doctor now, man, if I had a tool that could help me throughout my residency, help me throughout my training, my medical school years, I could be so much better. And so my big message today will be, we need to leverage human plus AI will always be better than just human or the best AI out there. It's both of them together. And so that one will drive that point. And so I look at healthcare and I'm like, okay, where do we see it? Obviously, I'm really excited on the diagnostic portion. There's tons of fun news out there that say, for example, just literally this week, Fox News asked me to do an article for dementia and AI, and the skinny is this. They have an EEG that could be placed on anybody in this conversation right now. They've trained the algorithm of the AI to look at the patterns of the EEG to say, you know what, this person is at risk for dementia, and they probably will get dementia based on these brain waves. And they don't have dementia, but they are starting to be able to predict. And so having these diagnostic tools to be able to predict when someone's going to have something before they actually have the disease gives me a huge leg up. For example, anyone that was speaking during this conversation, if I had the algorithm hooked up to this Zoom call, I would be able to know who on this call is pre-diabetic. And I could side text you and be like, hey, the algorithm is picking up a high sugar based on your voice. And there's some algorithm just on this video. Again, the predictive analytics, the diagnosis, to be able to diagnose AI, man, this is just huge. When I look at the personalization of medicine, imagine if I could know your DNA, your genetic makeup, put it into AI, excuse me, take a sip, and put it into, put it into AI and know your genetic makeup, and then say, you know what, these 3 drugs will work better specifically to you or someone else. Man, amazing. But my brain cannot handle all your genetic makeup, look at every gene, look at everything, and then know what's out there. But if I can leverage that and then put it into AI and then work that whole thing that I just mentioned, human plus AI, man, now you'll get better medicine. And so as I move forward, we have, I'm a big history buff. We all heard about IBM Watson, especially if you're in this field. IBM Watson basically wanted to have all the algorithms for oncology. So if you had a particular cancer, I could jump into IBM Watson and say, okay, my patient has XYZ cancer. What is the latest drug? What is the latest clinical trial? Unfortunately, it was asking too much from the AI back then. But now we're seeing companies like Tempus and Cora Medical, and these companies are now able to do this. What IBM wanted to do back then, these companies have been able to figure out. Unfortunately, Watson went bankrupt. They ended up selling, and some other companies still using it. Other things that are out there, big one is in medicine is Epic. Epic is our medical record, electronic medical record throughout the United States. I forget what percentage of the market, but if I had to guess, it's over 70%. What they are doing, obviously, they're in bed with ChatGPT, they're in bed with Microsoft, and they're already in the forefront of seeing how can they use AI. I met with the CEO in March, and she showed me a prototype with the Apple Vision Pro. And in the Apple Vision Pro, they're literally, I can put these on and be in Epic and see in the virtual world your labs, your X-ray, and be able to put all that together. the Cleveland Clinic is now saying that they're able to use AI to reduce readmission risk. So how interesting as a physician, I have 20 years experience, but there might be some data points that I may miss. Imagine if I had a digital twins that they're able to create different predictive analytics and then look at that particular patient and say, you know what, you match another patient population. And because of that, I'm going to have to keep you in the hospital another few days to do X and Y. I mean, that's huge. One of the fun things that I like is seeing how we're going to use preventive medicine. I'm going to play this video real quick for you guys.
Hi, I'm Sarah, and it's so nice to meet you. Human health is my specialty, and I want everyone to live a healthier life. There is so much we can talk about, from tobacco products and alcohol.
And I'm going to pause it for a sec, but the skinny is this. The World Health Organization created this bot. It's primarily focused at preventive medicine. So they're using for tobacco, e-cigarettes, mental health, physical activity. But this thing is open 24/7. This bot is in 8 different languages. And if I was a family practice physician, I would have this on my website. So my patient can talk to the bot. Everyone here can relate to some doctors out there you wouldn't want to speak to. You wouldn't want to tell them X and Y, but you might want to talk to the bot. You may wake up at 2 a.m. and be like, you know what, I do want to talk, but you're not going to be able to get a hold of a doctor. But I think this will be a great example. So I show this just to kind of show you what the proof of concept is. As we move forward, one of my favorite things to talk about is the computer. When I'm seeing you as a patient, if my computer is faced over here on the left and I'm typing away and I'm looking at you every other second, I'm not really spending time with you. Yes, you're there physically, but I'm not looking at you. I'm not catching your eyes. I'm not looking at the twitch or something you say or little signs that can give me as a doctor a lot of input. If I ask you a question and I'm looking away and you lie to me, I won't catch it because I'm not even looking at you. But if I can turn on AI to now be part of the conversation and record us, and now I can look at you and I don't have to type, my attention is on you, I'm going to give you better care. So I'm excited about all these different devices that are out there that are catching our conversation, putting it into my electronic medical record. Obviously, burnout is huge. Physicians and nurses went out. I have, at one point I owned a physician company and some of my doctors would stay 2-3 hours late just typing because they couldn't type. Imagine them now being able to have time with their home loved ones, not wanting to retire because now they're actually having to put all this grunt work back on AI. I show a little picture here of this device called the Limitless. They changed the name. I'm interviewing this guy in September, the CEO, but what they've done is the following. It's a little clip. It's AI. It'll transcribe everything. He's going to push it to, his wife is an ER doctor, and he's going to push it to be HIPAA compliant. So he's going to make sure that's there. And so this conversation right now, I could have Limitless right now recorded. But if I had dependent, imagine using that in the physician healthcare role where now Dr. Harvey said X, and I'm like, man, I forgot what he said, but you know what? I have a transcription of the conversation. And then now you can have a conversation with our conversation. You can start typing back and forth and say, okay, he said this weird disease and I didn't want to ask him what it is. Well, now you can have a conversation. So we'll start seeing this very common. The other one is Hippocratic AI. I've been following these guys before they even became a company just to see their voyage and what they're doing. But I'm going to play a quick video for you. Oh, let me go back. Should be. You know what? I thought I embedded it in this thing, but it's not on here. My bad. What you would find is a video conversation of the nurse and the doctor going back. I'm sorry, the nurse and the patient going back and forth. And this AI is able to extrapolate what meds were used, what side effects. It has the feedback loop where it could go through and say, okay, this is correct, this is not. But just going through a checklist and being able to do this company, I believe, is charging about $8 an hour. The going rate, depending what part of the country. I mean, I've seen some nurses get $50 an hour. So if you're able to leverage AI, this would be amazing for our healthcare system. Add another layer to this if you add the emotional portion where this is not just a phone call, but we turn on the video and now you can see the patient's emotions. If he's upset or she's upset, if she's angry, change his tone, and then have the AI modulate and go back and forth, be able to adjust. That's what we'll be able to see. Obviously, this is really scary, There's nurses out there that have protested over this. And if you go on the news and just type in Hippocratic AI nurses protest, you'll see tons of articles about nurses not wanting this product. Going back to the administrative side, at one point, I had about eight hospitals, and I had about 350 employees. Having AI back then would have been amazing. Being able to do some of the administrative tasks for me where I wouldn't have to worry about so many things, instead worry about the patients or worry about training my professional force. You'll start seeing more and more of these products. Nabla AI, I'm just going to point out, that's another electronic medical record. I met the CEO, pretty interesting company. It's out of Europe. They've embedded the electronic medical record into Chrome. And now if I'm doing telemedicine with you, I could literally do a whole note and I don't have to type it. It'll transcribe our conversation. It'll put it in the right places. It'll summarize for me. If this company is a startup and just started this, I can't imagine where we'll be in a few years when all the EMRs will have these features. One of the biggest things, and I know Doug's on the call, is communication. And honestly, it was just more of like a public service announcement. Let me create this little bot to help patients, because I know as an ER doctor, it's all about communication. If you come see me and I can't speak your language, I can't understand what's going on, then I'm not giving you great care. So what I created is this little bot. I made it free, and I said, before you see the doctor, use this bot to summarize questions. What are you going to say to the doctor? And that way, in the average visit, it's only 13 minutes. But I want those 13 minutes to be great. Instead of it going back and forth like, hey, how was your weekend? This and that. And then you run out of time. Why not go in and say, look, I have diabetes. These are top 3 questions I need to ask you. I have hypertension. What do I need to do? And then the conversation. And then I'm taking it to the next level. I tell patients, have your doctor be okay with you have a laptop open and have ChatGPT open, then where you can go back and forth. And if it hallucinates, your doctor's right there. And I know doctors hate it when I say that, but at the end of the day, what's best is what's for the patient, not what's best for the doctor. And so this is a little bot that I created. In the whole communication theme of how do I talk to people, I was able to do the following. I take a core discharge instructions. I take those core principles. What am I trying to tell my patient? In this particular case, it's a kid that has asthma, has never been diagnosed with asthma. So I took the core principles. Then from the discharge paper, I put it into AI to make illustrations of every principle. And then I made it into a coloring book. Then I wanted to give my voice or modulate it so that way, if they're comfortable with me, maybe they want to hear it coming from me. So I'll play
Correct
this.
inhaler technique for children. Managing asthma triggered by sports. Communicating asthma symptoms to adults.
So that was obviously my clone voice. It sounds just like me. In fact, I played it for my mom, and my mom's like, yeah, that sounds good. Good job, Harvey. I'm like, Mom, that wasn't me. That was my AI. My point is this. These things are only getting better. And
correct inhaler.
Let me go to the next slide. And so I've been changing my discharge instructions for kids, for coloring books, for teenagers. I make them comic strips. I've taken it to the next level where I have my own GPT podcast. It's a clone voice of me, my business partner. I can take any blog, I paste it into my GPT podcast, and then it does a fake conversation that AI hasn't analyzed on that article. And it goes back and forth, my business partner and I arguing about a point, explaining the point, and then it's out there. I thought, man, if I could do this for that, then I could create discharge instructions and it's my voice. And so just to kind of show you proof of concept. Here's another plushie. This little plushie, I'm creating a prototype for clinical trials right now. And what I've done is the following. Say there's a little child, he's going through the hospital, scared, doesn't understand that he may have been diagnosed with cancer. Now this plushie would be able to have a conversation, and I'll just show you a quick little demo. Tell me about this device, and I wanted to check it out. Hey, Grok, how are you?
Hello, Dr. Castro. I'm feeling charged up and ready to explore with you.
Nice to meet you. What all can you do?
Nice to meet you too, Dr. Castro. I can tell jokes, play games, and chat with you.
I'm not gonna do that, but just to continue. So basically, I'm working on programming this so that way when a child's going through an issue, I could help them through the hospital stay. My goal is to have the prototype up and running by November. I'm presenting for a PEDS conference, and that way they can see this proof of concept and how this, I think, could help the world. And then obviously there's some lag time. We're working on making sure that doesn't have lag time. We're working on changing the voice. If that little girl or boy likes XY character, then we're looking to see if we can license that voice, use that image, and to really optimize this for those children. Now, this other slide is amazing. Some of you guys may have seen this or not. But again, my brain is looking at it from a doctor's point of view. If I could create a picture and discharge instruction, give you a video every time you were discharged, and I could do it quickly, then I think I can get to you in a better way. If I give you the best discharge instructions, hopefully you take your medicine, hopefully you'll follow up, but hopefully you'll have that better experience. And I thought, man, what if I could just take any picture, create my discharge instruction, dictate to it, and then put the two together and then give you the video. And so here's this proof of concept so you could see it.
Have you ever had, maybe you're in that place right now where you want to turn your life around and you know somewhere deep in your soul there could be some decisions that you have to make, like.
So basically what that is that image is that picture on the far left, and the AI took the audio clip with that image and was able to make that video. So her grimacing, her moving around, her speaking, the lip sync, all of that was done with AI, which is crazy because it did it in seconds. Microsoft will probably, my guess, it's probably release this product after the elections, but something like this in my hands of a discharge, man, this would be so much fun to help my patients out. Obviously, I'm not wearing my my Apple Watch, but the big thing is having wearables, having telemedicine. So we're seeing all these different companies combining your wearables, combining it with your telemedicine and giving you a better experience. A couple of months ago, this was kind of interesting to me. There's a blood test now that they were able to extrapolate with AI that literally 7 years before you're diagnosed with Parkinson's, this blood test, thanks to AI, can tell you you will have Parkinson's in about 7 years from now. And so again, just the predictive analytics portion to understand. And I know there's a lot of ethics and issues behind this. If they have a predictive analytics of something and there's no cure for it, no treatment, then I personally may not want to know. I want to know that I have X syndrome and there's no disease, but maybe someone else would want to know. And so having those tools available, I think it's going to help humanity. Again, God willing, maybe there's a syndrome that you are diagnosed with early, but then now you're looking at the clinical trials. Now you're out there trying to figure out what's out there that could possibly be a cure. So I think this will be good for humanity and help us as a country. Sorry, I repeated this slide. I didn't realize I had it there twice. This is another fun AI. I took some pictures of myself, uploaded to AI, cloned my face. So I could pretend to be a doctor. In this case, I am a doctor, but I could have fun. I made a couple images of me as different adventures because I love Marvel comics. So I literally have a post that has me as Spider-Man, Superman, like any superhero. And it was pretty kid. My kid in me came out. But my point here is I want you to watch this video. And the other part to this is, obviously, this is not me. This is a deep fake of my face. I've always wished I had a better accent. I wish I had a British accent. And so here's my attempt to one.
Limitless pendant preserving conversations, lunch meetings, conferences, client calls, or doctor visits. Personal reflection, verbal processing, thinking out loud, capturing a thought while your hands are busy, organizing the unexpected. To-dos, reminders, or just reliving precious moments. Agenda HIPAA compliant.
So that's that pendant that I was telling you about. So it kills two birds. It reads my slide, it shows you proof of concept, and it kind of shows you how that pendant would work. One of the biggest things that I'm so worried about is Dr. Google now is converted to Dr. ChatGPT, and what's going to happen if a patient just says, you know what, the hell with medicine, I got a subscription to OpenAI, I'm just going to have OpenAI tell me. That worries me. I don't mind teaching doctors how to use AI. I'm more worried about patients because doctors or healthcare professionals have been registered through the state. The state has given them a license to say, here, you have a license to practice medicine. So in my opinion, if AI comes at them, they understand this is hallucinating, it's not. Plus me as a physician, I'm literally going around the world teaching doctors how to use this, telling them how to use it rightly, how not to use it. So I made this little algorithm. it's in one of my books, and anyone that asks me, I just give it to them, and I'm pushing hospital systems to have something like this on their walls. But the goal is this. It's just saying we need a doctor in the loop. We got to make sure that if AI is giving us some output, that we have a professional to say, you know what, that is correct, that is not correct. And that's basically that diagram. Some of the challenges as we move forward is, how good is this quality of this data? Has this been standardized? I was talking to a doctor on another product that I'm building to help teach empathy to doctors. And he was arguing with me saying, well, your AI is going to be biased. And I get what he's saying. But my argument back was the AI is going to report what it sees. And you may not like what it's seeing, but my goal is for it to take that data and show you what you did incorrectly and fix it. And I know one of the biggest challenges is going to be culture. Doctors that have been practicing 20, 30 years do not want to be told by a younger resident that they know more than them or that a computer knows more than them. So there's this cultural battle right now going on with physicians and this new technology. And that's what probably makes me stand out, that I understand medicine. I can talk medicine and I can explain the strong points, and I'm able to convince them. And hopefully I'm training a lot of doctors in AI. Other challenges, obviously we need to look at the regulatory piece. We know the executive order came out. Now we're changing presidents possibly, or parties. So we need to see where this goes moving forward. So for me, when I speak, I pay attention to what part of the country, part of the world, what am I explaining, what am I teaching? And then the other part is AI. You guys are here learning. So some of this stuff is old hat for you because you've heard of this before. But imagine going into a room that no one's ever seen a deep fake or some of these things. And believe it or not, you're like, no, that's impossible. No, a lot of people still don't know that this exists. I love this slide in the sense that, what will the future hold? To me, the future, in my opinion, will be robots. We will see robots in the near future. Elon Musk, sorry about the background noise, that's going to stop here in 2 seconds. But Elon Musk said that the fourth quarter of 2025, he will start having robots out that you and I could purchase. I've seen prices varying from between 10 to 35,000, but I'm thinking, gosh, yes, $35,000 is a lot, but if I had a hospital, then I had an aging population of healthcare professionals, and let's just say a nurse that said, hey, my back hurts, I can't lift patients anymore, I'm going to retire, I'm out. But if I could get one of these robots to say, hey, this robot's going to help you lift the patient, this robot's going to help walk the patient to the bathroom, this robot's going to be able to do a lot of the things that I don't want you to retire, now I'm hoping maybe my nurse will stay. On the doctor world, I know you guys may cringe when I say this, but if I had a robot next to me that's able to hear me, watch me, and tell me, hey, doc, you forgot to look at the patient's ears, and part of the differential diagnosis of possible diseases this patient has is X syndrome in the ear, but you never looked in the ear, then I'm like, oh my gosh, you're right. Let me go look in the ear. If the robot can help me with my pre-screening and say, hey, like I mentioned that example earlier, that patient has diabetes, the voice has changed. Hey, that person has depression, and these are the reasons why I think they've changed. The last time their voice was this, but I can detect certain words were used, the tone has changed, the rate has changed, and if you didn't catch that, this is my assessment. Man, that's huge, because I may be multitasking. I may be talking to you, looking at the labs, analyzing, going back and forth, and I may miss it. But if I have that companion, the other is I'm a human. 3 in the morning, I am not at my best. 3 o'clock in the afternoon, probably pretty good at my best. And so if I have AI to talk to and say, hey, here's this disease and X, Y, and Z, and it's going to help me leverage. And I just see that as the future. These models are getting smaller and smaller and smaller. I love that it's going to be on the iPhone. I'm personally working on some models where I'm going to be putting some AI specifically on the phone. Imagine not worried about your information going to the cloud, but it's on your phone and leveraging AI. So those are the things that we'll start seeing. My favorite example that I've came up with is this. My mom, ironically, was in the Grand Canyon about a week ago. And imagine you're in the Grand Canyon. Imagine no one around you is anything in healthcare, and someone keels over and you have no idea how to do CPR. Well, what I would love to do and get a hold of Apple is to put CPR and basic life support on your phone. So then I can take it and say, okay, Tim, start CPR, and then have this thing talk and say, okay, your rhythm's going too fast. Hey, you're going too slow. Hey, we're catching that you're not going deep enough. You need to go a little deeper. The AI will all have that information here. And then imagine that we need to get a helicopter. We need somebody to come help this person. And then I grab my phone, look for the satellite, get a signal, and send a text saying, hey, I need a helicopter here to save this person. And I see that in the power of AI, and I see it in this small language model. And so this is just the architect of what they have. But big picture, if the phone cannot answer your question, then they're going to take it to the next level, and it'll be internalized within Apple systems. Then you can ask the question within Apple, and it'll all be secure. And then if you still cannot get an answer, then it'll ask permission saying, hey, can I go to ChatGPT and ask the same question? And so then you decide if you want your data or your question out there. The conspiracy theorist in me, the ER doctor in me says, every time you ask ChatGPT to ask a question, Apple's going to see what question you asked to train their model. So that way they don't want you to leave. And that's what I see happening. I then put on the humane pin on. This humane pin is this small little device. And basically I would hold it, have it translate. So if I was on stage, I would literally say something in English, ask it to speak in Spanish, and then it would translate it within seconds, and then you would hear it. And then I would show you how this little device could help me in healthcare. Other devices that I think will be interesting is this Rabbit R1. This, again, is just a prototype. It just came out. But it's good to know, as a physician, if I had someone having a heart attack, I could take a picture of the EKG, have the AI analyze it. Obviously, I would know myself, but it could say, yeah, I do see a heart attack, and this is why. Then I can say, hey, send a text to every single doctor that's involved, and it would activate the cardiac team, tell them they need to come to the hospital. They would see the EKG. This would also simultaneously let the hospital administrator know. And so things like this, I really think is the future. This thing costs $200. I'm telling hospital administrators, as this technology gets better and better, we can start changing our workflow. Me personally, I'm having fun with this. I connected this to Midjourney. When I do presentations and I don't feel like stopping my workflow, I said, hey, I need a picture of a doctor holding a Rabbit R1 with an EKG. And then it'll make the image, puts it on my computer. If I like it, boom, I put it on my workflow. I'm able to create songs this way too. I'm like, hey, I need a song talking about X, Y, and Z, and it'll make it, just me talking to it, and then I'll have it on my computer within a minute or two. I'm really excited, like a little kid. Brilliant Labs literally just gave me an email last night, saying that I will get this on Tuesday. Unfortunately, I won't be home. But what makes me excited about this device, these are the Meta Ray-Ban glasses. It has AI in it. So right now, if I hit a button, I could take a picture of you. I could have a conversation with ChatGPT. So it's linked to my ChatGPT. It's also connected to Meta. If you ask me a question, if it would heard it through ChatGPT, it could tell me the answer through my ear and you wouldn't hear it, and then I would go back. So the difference between this and Brilliant AI is that Brilliant Labs is going to have a little monitor right here. And so you see that image where it shows you. And my idea is I'm working on some workflows that I'd like to pair that I have to the glasses. Simple example, and I really want to do this on stage, is I want to pair it to some really crazy, deep quote, and then have it on the glass, and then read it out to people, and people be like, wow, I can't believe you memorized that quote. And be like, no, it was on the glasses. Just to show you proof of concept. This one is crazy. If you haven't seen this, and I need to stop using that word crazy, but this makes me really excited. It's called the IO1 AI earbuds, and I cannot wait. Again, my wife's going to divorce me because I keep buying gadgets. This is another one I ordered. I'll have this in December, but I got to play this video for you guys.
These are not just fancy looking earbuds. They're an entire computer, and we think they're going to replace some of what we do with the visual computers that we're used to. We've created a new audio-based user interface, which relies on natural language as the input, and what we call auditory space as the output. And we're hoping that these innovations will help us.
So imagine a computer on your ears that you can have a conversation like ChatGPT. And now let's look at the next slide, because the next slide is going to blow you away.
So imagine that you're sitting in a noisy restaurant and you're having trouble hearing your friends across the table. Hey, can you enhance the sounds that are right in front of me? And can you turn that baby down? That's better. And you know, I'm still having a little trouble hearing Pedro. Can you isolate Pedro for me? That's perfect. And you know, my Spanish is a little rusty. Can I hear Pedro, but in English?
And at the end of the trip, we came back to the city to visit the historic center.
Michelle, close all program.
So anyway, crazy, right? Imagine having this on and I'm in the ER and able to translate in real time and take off the noisy sound around me and just focus on the patient. And if I have a question, being able to ask AI, he'll help me out with this differential. Just mind blowing. I really like that example when he turned off the baby and then he didn't understand that language. Just blew my mind. The next portion, and I know we're getting close to the end, is the legal framework. And I'm personally worried because I really see a future where damn if I do, damn if I don't. If I use AI, I'm getting sued. If I don't use AI, I'm getting sued. And that's where we're at today. And it's going to be really interesting because once some of these things hit the court system, it's going to change us in a way that possibly hospital administrators are going to having to start buying these things because they're like, okay, if I don't have this, this is now quote unquote the standard of care. So it's going to be a crazy legal ride in the next few years because of this. Mayo Clinic right now is saying, hey, we're using predictive analytics and we're able to reduce readmission rates by 15%. Mass General is also using AI to help diagnose more accurately their x-rays or CAT scan. Imagine getting a CAT scan and it says, oh, it's just a little nodule on your lung, nothing to worry about. But then AI going through and saying, you know what? No, that's not a simple nodule. That will be cancerous in 20 years. And so imagine knowing 20 years before something that your doctor's like, let's just shoot an x-ray or CT in another year and see if that's anything. But now having the predictive analytics of AI to tell you, no, that actually is cancer. Just mind-blowing. As we move forward, I'm going to encourage you guys to follow different people. Somebody gave me this slide and I'm thankful. He put me right in the middle. He said, Harvey, I feel like you're a doer, you're realistic, you're optimistic, you're right there. But I'm going to encourage everybody to follow people from all ends, follow people at the top, on the right, on the left, at the bottom, because at the end of the day, the more you know from different people's angle, the better you'll be. And so as we move forward, I want to encourage you, it's human plus AI is better than just the best human or the best AI. And have fun with this technology. I use this whenever I'm on long car drive. It's called chatter.humane.ai, and I'm going to show you what it does.
Can you tell me about AI and healthcare?
Oh, this is a fascinating area. AI is making waves in healthcare with some groundbreaking developments. Firstly,
sorry, I was just raising the volume.
Scientists have developed a simple blood test using artificial intelligence that can predict Parkinson's disease up to 7 years before symptoms appear. This could be a game changer in early diagnosis and treatment planning. In California, AI is being utilized to translate healthcare information.
So I'm just going to pause it, but the skinny is this. You could literally, on your next drive, have a conversation with the news. Say, hey, what happened today? Tell me about X, Y, whatever it is you love. And you're literally having a podcast, but you're just having an interactive podcast. So it's able to hear your voice. What did you ask? And then tell you a topic, and then you can go back and forth, and it goes into the latest news. Mind blowing. Again, it's that whole thing I just said. AI plus human is better than human alone. I specifically made this song for you guys, and I won't play the whole thing, but
saw your smile on the screen, heard your laugh in between quick questions asked, hands up high.
And I won't play it, but what I did is I was holding my rabbit. I said, hey, I'm giving a talk. I listed who I'm speaking to, what I need, and then it literally made the whole lyrics for this particular conference, for this particular talk, and it's a whole AI that it made, and then it's there. So just, again, proof of concept of how these tools work. I made these cheat sheets on how to use AI in healthcare. You're welcome to go to my LinkedIn and take them and download them, but it's different ways of how to use it. I also made a digital twin on my website. I took all my presentations, all my books, all my podcasts, every single blog. I put it into my own model. And now literally, if you go to my website, let me go back. There's a little eraser on the bottom right on the resources, and you can literally have a conversation with me. You can talk to me about the Apple Vision Pro, about the Rabbit, about ChatGPT, about ethics, and it'll go through and it'll go back and see what I thought on that subject and then tell you. I even uploaded my resume and it says, oh yeah, Harvey went to med school here and he went to grad school there. It's kind of fun. Like I started at the conversation, let's have fun. And obviously this is deep fake and I'll play it for you. So I won't bore you with that, but the skinny is.
Hasta la vista, baby. I'll be back.
And I'll be back and happy to be here. Here's access to my slides. So if you want, just scan that. It'll take you straight to my website. Then you'll be able to download the PDF to these slides, and then you'll have them. Big picture, like I said, let's have fun. Let's use it responsibly. And thank you for your time, everybody. And I appreciate it. So
thank you, Harvey. That's great. We had some vibrant entries into the chat, and I'm sure I'll see some hands up here in a moment. Let me invite Ben. Ben, you were the first to post, and you were adding a lot of visual commentary, right, on screen along the way while Harvey was speaking. So come off of mute, join us.
Thank you very much. This is it was wonderful, Harvey, to see the broad spectrum as you weave together the various technologies and the adaptive domains of healthcare itself. And we were talking prior to the session a little bit about the changing roles. It's our historic legacy has been the physician being the central artifact and decider, and now as we build trust more and more, we can distribute that. It's not just amplifying the physician, but also amplifying the nexus of actors, AI and human. And so it's not just empowering the physician. Can you speak to that a little bit more as well? And also where you see the resistance from the institution, the payor side of the house? Who's the challenge here?
So great question. I really think these tools are going to empower all of us, no matter what industry. Obviously, today we talked about healthcare. And I do see a future that I do see physician assistant nurses using these tools. And if a physician, let's just say, is not keeping up, this nurse or nurse practitioner or PA is going to be better than the doctor in many ways, even with all those clinical years of experience, because they're not leveraging. And I'm not saying that the AI is better than the human. I'm just saying if the human knows how to use it, let's pretend I'm not a doctor and you put me into, let's just say, let's take another vertical, a non-healthcare vertical, and you say, Harvey, we need you to do X. Well, you give me AI and my brain and put it together, I'll be able to do a lot more than the average person just because of the tool. Where are we as a culture? Unfortunately, healthcare is conservative, and that's a good thing. I say unfortunate because I'm an optimist and I'd love to see these things flourish, and I'd love to see it in the hospital system. And there's a lot of politics. One of the things I usually do when I'm on stage and I go over the unknowns, one of the unknowns I think it's going to happen is we will start seeing AI being used in healthcare that will not be used here in the US. We're going to start seeing things that if you're out in Ethiopia or in Africa and that country says, hey, my population doesn't have healthcare, but I'm going to do AI and I'm going to create a certain thing and this is the product, we won't see that. And I think once those examples around the world start hitting, the US is going to start demanding that legislation change, that the culture changes. And I do see eventually those products will be here. Good question. Next question. Go ahead.
Do you see the payor role here being an assistance or impediment? Or both?
Yeah, that's a catch-22. There's some stuff that hit the news that talked, I'm not gonna mention the name of the insurance company, but they're leveraging AI to make sure that they can deny patients care. And I think that's horrible. With that said, I know doctors that are doing the opposite. They're saying, okay, my patient, I'm going to use AI and I'm going to write the best letter that's going to send it to the insurance company to get paid for that procedure. Then I'm also seeing unscrupulous people that are wanting to make money on healthcare, having AI extract as much money as possible and to say that they did things that they didn't do to get more money from the government. I know those people will eventually go to jail, but this is on both sides that's happening.
Given the amount of time that you were describing that people have to spend in front of a keyboard, AI should be able to help fill in a lot of forms, right, that are demanded by insurers a lot faster, right, and potentially a lot more accurately.
Yeah.
I'm going to be alternating between people who raise their hands and people who participated in chat. Mark Prinsky, you have a question?
Oh, I come fast. I was hoping I would be a little bit later, but here's the question. Why should I ever trust a doctor again? The very first thing that you showed, Harvey, were the deep fakes, were lies. So, and then you said they're lies. Okay, that's fine. But it's the trust is going to be the huge issue. I've had lots of experiences where doctors were wrong, more than I would say. I would much rather have just an AI with a doctor kind of there, maybe partly in the conversation, or the AI saying, well, maybe you should talk to this guy, he's seen some things. I think we're going to lose all trust in doctors through a lot of the stuff that's I'm seeing.
No, I love that you said that. And that's why I'm excited that I'm getting to work with the Texas Medical Association and giving them my 2 cents of how we should move forward and how to make sure. And then hearing that from you, that's great in the sense that I see it from the patient's point of view, and to say, okay, docs, we're going to start losing credibility. And when I started this voyage back in journey back in 2022, one of my first things I said to my doctors that had no idea about ChatGPT, I said, if you don't know, and a patient comes in with all this AI, and you say, I never heard of ChatGPT, you're discredited. Your 20 years of medicine, all your degrees, all that stuff's out the window. So you need to make sure that you understand this really well. So I'm glad you said that.
All right, thanks, Mark. Greatly appreciate you joining. I have Doug, you were also one of our early postings, so jump in.
Right, yeah, and along with what Mark said, I think of a lawyer or a person who represents himself as a fool for a client, a patient who self-diagnosed, self-treats themselves without guidance from a medical professional as a fool for a patient. And, 20 years, your use of AI, how do you fact check that, right? And that's why you have a medical professional. That this is going to be the danger. I mean, people were saying, well, you no longer have truck drivers because AI will do it all. And, right now, there's things that the AI can do very well to keep when the truck driver's drowsy, or distracted. But at the same time, a truck driver can handle situations that the AI can't. And so it's amplifying the ability of both, right? It makes the doctor a better doctor. But if you trust solely on AI, you are going to have more problems than it's worth. Just a side comment, I saw Elon Musk's Grok is getting in trouble because people are saying, okay, can I not longer register for, file for an election, right? So I can vote. And Grok has wrong information in it. So, Michigan, Pennsylvania, and other states are saying, hey, this information is wrong. And so what we're going to find as we use more AI, if you're not vetting it properly, and that's why you need a clinician that knows what they're talking about, you're going to run into problems.
Yeah, agreed.
Doug, was there a question in there someplace that I missed?
Yeah, well, I guess the thing is like, Harvey, what percent of doctors are embracing this? Do you find which ones are like, oh, hell no, we're never going to use this? How do you see doctors, the gamut of where they're at in using this technology, and then also the patients.
Yeah, so great question. So on the doctor side, I'm gonna be biased and say it depends-ish. I'm generalizing here. It depends on age and location. If you have a doc that's going through residency, they're more likely to adapt and know and use, and they're using and teaching the older docs because that's their thing. If you have an older doc that's in West Texas that really does not want the electronic medical record, believes it should all be paper, and still uses the same treatment plan that he did when he graduated medical school, probably does not want AI. If I talk to some group of doctors in Silicon Valley that their friends are some of the people at ChatGPT or co-owners of all the different lot models, and they're like, oh yeah, no, I'm into it, and they're probably in the circle of friends that they're able to leverage things because they have access that others don't. So as a general whole, I think it depends on age, location, on the doctor side. With that said, I'm noticing this year compared to last year and the one before, it's starting to take more and more, and it's starting to be integrated and used. To go into the weeds, there's structured data and unstructured data. Structured data, think of your x-rays, CAT scans, things that are structured, and there's so many applications. Unstructured, think of you and I having a conversation in the office and me taking that data. It's not structured. So you would think it is, but it's not. And so we're not seeing as many applications there yet. So big picture, a lot of people that in the doctor world have accepted the structured data. AI telling them about an x-ray, CAT scan, that's accepted. When it comes to patients, I'm even more worried about patients because at the end of the day, patients, again, like I said in my presentation, they don't know and what's going to happen, and if they're going to start leveraging to the point where there's no trust with doctors and they trust this over a doctor, then I'm personally worried that what if they die or kill themselves not knowing, do something stupid, go to the pharmacy because they're in Mexico for the weekend and they're like, oh wait, ChatGPT told me I had this disease and I need these pills and I'm just going to pick them up. Like, no. So hopefully that answers that question.
Doug, thanks so much. And Albert, join our conversation.
Yeah, I don't have a question, but observation, since I work at the Medical Center at Columbia, that there's, part of what I'm doing is like using large language models more in the back end. So basically the REDCap, you might know about REDCap, is electronic data capture system, and being able to merge studies together, align attributes, that kind of stuff, and obviously in druggable medicine, druggable treatments, the ability to predict proteins is an amazing thing, protein folding, and I think there's a lot of revolution happening in accelerating medical research and just doing like boring stuff, I guess what people would say, just harmonizing data and aligning data.
Yeah, I love AlphaFold 3. I think it needs a Nobel Prize for what came out. I really do believe that. I think it didn't get much press, but I really think it's going to save humanity when people don't realize this tool. So I'm glad you mentioned it.
Albert, anything else before I move on to the next person?
That's it.
All right, fantastic. Thanks for being with us. Diane, are you on the call? We would be delighted to have you. You were making some comments about in chat about your use of the I'm trying to do some controls here. Sorry
Yes.
about that. I almost got rid of Albert accidentally, just pulled him out of the conference as opposed to just removing the spotlight. So you were using this in a library setting, correct?
Right. So I'm in a rural library in Texas, and we have digital navigators and now some subspecialties of digital health navigators. So I'm looking kind of the opposite end of the equation that you are. So how can we help the public learn about these things? Do you have resources that you might recommend? And the other thing that we've come up with that I think really is helpful is connecting. We've created an AI chatbot that has all the local resources of food banks and crisis centers. And in a rural community, people might not want to ask a human where the crisis center is, but they can ask the chatbot. And then it's keeping all of those questions in the language that they ask, which I think can inform the work we do. So digital health navigators, how can we help the public learn about all of this?
Yeah, love it. I agree with you. I think 100% bots are helpful in that some humans don't want the human being knowing, and I'd rather them get help, and even if it's robot, and then hopefully from there they go to a physician or a professional to say, hey, I need it. It's a great thought. As far as resources, I know I need to do better. I need to make my own list and share it. But I've seen Google and all the major players have AI products that they have that are free. My only problem is I don't feel like it's too consumer friendly. I want it super, basic one-on-one, 5th grade level. This is how it's done, because when you start going too far, they go 2 minutes in and I'm like, that's too much. I'm out. And so I think I'm glad you mentioned that. I'll see what I can find and start creating a list and maybe add it to my resources on my website, because that is very needed. As far as using technology, I can't believe you guys are doing the bot. That's awesome. So keep doing that. Because at the end of the day, that's the advantage, right? And that's why I created my little bot, because I was getting all these emails and questions. I'm like, I'm gonna send them to the website. That way it answers probably most of the questions. So hopefully that answers yours. But thank you for coming.
Fantastic. I'm going to ask Suzanne to join us. You put some thoughts in chat. You're on mute, Suzanne. You're like a Pink Floyd album. I can see your lips moving, but I can't hear what you're saying.
You're on mute, Suzanne.
She may have to put it in the chat, the question.
Yeah. So, Suzanne, we can't hear you.
She said 1 second.
Back.
She's trying.
There we go.
Oh, there
All
you
right.
go.
Oh, there you go. Yay.
She's live.
Unmute. Oh, hi, Harvey. Excellent presentation. Okay, my question, if AI can detect without a fasting blood test your sugar level, what other applications could it do? I mean, it's almost like knowing the conditions or, the symptoms a patient is having, and then link that back, connect it back, that, this is a common state that a patient is in, for it to mean that, they have all these symptoms. I mean, where else can this go? I mean, this is incredible that it could show with your speed.
Yeah, and the interesting part, we need more healthcare professionals to think outside the box to be able to apply. I see stuff and I read it, I'm like, oh my God, here's a Rabbit Pro and we could do this, this, and this, and blah, blah, blah. And we need more of that, because when these developers are creating and doing, then we can get it to the market and get it to the masses. Obviously, with those examples, it has to clear the FDA, but there's so many different things. It could tell me your blood pressure, your age, the diabetes, the depression, Alzheimer's, Parkinson's. I mean, there's all these algorithms. Do I see that in the near future? The problem is it costs so much to get this FDA approved. But again, this is my whole thought process, is once we start seeing it used around the world, people in the US are like, why? Why don't I not have access to this thing? And I think that's going to push. So it'll be really interesting to see this movement move. And I know the FDA has cleared, I think the last time I checked, 953 AI approved products, which is a lot. Obviously, a lot of them are radiology, but I'd love to see more of these things.
Well, breath detect cancer. So everybody's walking around breathing into their phone, and that's it is.
Yeah.
Interesting. Wow.
Yeah, thank you, Suzanne. Greatly appreciate that. I want to point out to everyone that we are now at the bottom of the hour, and so this is when we thank you, for the main portion of our program, and we go into overtime. Right? Are you able to stay for us a little bit longer?
I have a hard stop, but I'll stay for like 5 more minutes, and then I gotta run.
Then it'll be a shorter.
For me, you guys keep going, but I apologize.
but
Sorry.
that's great to know that you can just stay with us for another moment. Mark Prinsky, why don't you jump back in for a second, because you had some other thoughts that you wanted to share.
Yes, I I do. So you keep saying this tells me, it tells the physician, it tells them this, and why doesn't it just tell the patient? Why do we need the physician as an intermediary anymore in terms of diagnosis? Maybe we need you in terms of treatment, but I'm wondering why I actually need to go to a doctor when I can just every once in a while check in with my AI.
Because at the end of the day, most people are not going to risk their health, even if it's a 1% chance. And so at the end of the day, you need a human in the loop to make sure this is not incorrect. And so that's how I see it.
But you've just showed us that the human is often incorrect and often lies.
I know I showed you that the AI can make mistakes and the human can make mistakes, and it's both is what I showed you.
Well, I
It's better
agree
than
that,
a
okay, we
simple
agree.
one or
I
the
say
other.
symbiosis. I say symbiosis, and I agree with that. But it's scary when doctors say, we know. When
And I think it
mostly,
takes a special doctor to know their limits and be humble and to use both.
I hope that's you.
Yeah, and at the moment, this will be my last, thought is that humans are licensed to practice medicine, not the AIs. Now, there may be a point where you will have a PA licensed, to do certain kinds of things because we trust it, but the law is going to have to catch up, right? And like you said, there's a lot of both and. Harvey, why don't you give us your parting thoughts so that you can get on to the next thing that you need to do?
Yeah.
We're very grateful that you could be with us today. Your closing thoughts or anything that you want to ask the community for that you need to be able to move your mission forward.
Yeah, I should love that. I'm going to go to both of those. Parting thought is at the end of the day, it takes a village, and this is our village. Let's work together at, right and wrong, whatever. It's just bringing all the different points of view to bring them into one so that we can help each other. We're going to see a bell curve in the room. People are going to be lovers, haters, but at the end of the day, we're all feeding into one ecosystem, and it's to help the greater good. And so my Q&A session here was great because it takes it in and I'm able to analyze and create the better good and how I can help institutes out there. As far as what I need, I do appreciate, for example, I'll call Doug out or you guys when somebody sends me a text or LinkedIn and say, hey, Harvey, have you seen X or Y? Because I can't see everything, I can't read everything, but then I literally count on my community of friends to say, hey, Harvey, have you seen X, Y, Z? And I know that if 2 or 3 people are telling me the same thing and I haven't, I'm like, okay, crap, I really need to look at that. And so it helps me. So that's one. Second is by coming to these conferences and talks like this, teach your other friends around you, because it's all great that we're helping, but if we can help each other, then we're building the community higher level, higher. I look at it as an IQ. So we're helping our AI IQ improve, and then we're helping each other. So that's the greater good. So that's what I would like.
Mark and Harvey, thank you so much for being with us. All the people who asked questions, we're grateful. And we look forward to hearing all of the new talks, books, products that you're coming up with, and keep us posted. Greatly appreciate you having us with you today.
Yeah. And one thing I forgot to mention later, I encourage everybody to take a look at that Speaker Plus AI, because that'll be launching this week. And it's going to be a cool little tool just to analyze how you speak and have AI help you, do better. So anyway, we'll chat later, but thank you, everybody. Have a good one.
Thank you, Harvey. Now, I want to just point out for people who are with us, one of our people on the call just launched their new book. Mark, you want to say a little bit about what you just released into the wild?
Well, thank you for that. Yes, my new book is called Third Millennium Kids. It's a hell yes, low stress guide for everybody. And it's really a very different perspective on how we should start thinking about bringing up our kids in the third millennium. That the idea of taking things away and giving them the old curriculum is no longer useful. What we need to do is get their enthusiasm up for whatever it is they're enthusiastic about, lower the stress level significantly, and then boost their imagination, self-knowledge, and the amount of real-world accomplishment they do. So that's the thesis of my book. I hope you all read it. It's Third Millennium Kids. It's on Amazon. And thank you very much for the opportunity, Kevin.
You bet. I had a chance to read the draft manuscript and looking forward to rereading it in its final form. Other thoughts, questions on the topic that we raised? Hello, Brian. You're raising your hand to come
Yes.
off mute. Join us.
So my question to Harvey, I guess I'll put out to the floor. He spoke about the both human and AI.
Mhm.
And I certainly agree with that concept, but my question is, you have to drill down. Is Harvey saying equal authority between the human and the AI? Because I unfortunately am the former trial lawyer, and I think some human being can be held legally responsible. It's either going to be um, it's either going to be the doctor or the human or the AI. So I just wanted to point that out, that there is as a singular lawyer in the house, maybe there is this, and Harvey mentioned it, but
Yeah.
I don't think it's equal.
No, I can't put words in his mouth, all right, but I've heard Harvey talk on a number of occasions, and I think he'd be an advocate for the person who is licensed to practice medicine being enabled by these systems, right?
Yeah.
And
accountable.
He had that chart up that said you're going to get sued for not using AI, and you're going to get sued for using AI. And I think it's the quality. It's always going to be you're going to get sued if there's a bad outcome, right? I mean, did I not get the outcome that I wanted as a patient, or as a medical practice, or an insurer and a payer? So at any rate, Ben put in the chat, whose throat am I choking? And that's ultimately.
That's just Ben.
Yeah,
He's that Chicago guy. But my point, I think, just let me make one last point.
Please.
It's not about being sued it's about who wins at the end of the day. When you've got 12 people in the jury box, and the question of, if you didn't use AI, yes, there are cases like that. But if you can't blame it on AI if you're the medical licensed doctor and your patient has a terrible physical outcome.
Yeah, having doctors in the family, what they, in their specialty, what they would say is, can you prove that the person kept up with the literature so that they were giving contemporary diagnoses and practicing in areas with treatments that were considered to be best practices?
Yeah.
Well, I would argue reasonably available. You don't have to use the best.
True.
You have to use what's reasonable.
Well,
again, what's reasonable will be decided by those 12 people sitting in the jury box.
100%. If it's a jury trial, you're exactly right. Ben, jump in.
Yeah, a couple of quick things. It introduces that notion of truth maintenance and version control too, because it's not only the AI, the instance of AI that was used at the time of the decision. And so you have the issue of, and again, the throat to choke is a true respect. If you say the ultimate owner of the decision is the physician, and I would say that's getting more complicated as we start looking at PAs and RNs given more authority as well. But also the issue of the AI and version control. Brian, 30 years ago, I worked with Elizabeth Holzman and the Brooklyn District Attorney's Office, and we were looking at AI in classifying cases. and these exact same issues came up. And what came up is the first thing you would subpoena as a defense attorney is the instance of the AI that was used in the decision on my client.
Right.
And so we haven't even faced issues that look at the instantial representation, the truth maintenance, and version control of the LLMs and SLMs and nexus of SLMs that are a part of a decision process.
So, my question, if you're a physician without the AI and you make some sort of decision, does anybody go back and say, did you read the article by Fred Smith in the Journal of Medicine, which is the latest report on the subject? Is that part of the discovery process?
Again, gentlemen, it's the 12 people at the end of the day who will decide whether or not it was reasonable or unreasonable to read that article and to implement it.
Okay.
You know, that's
we're not disagreeing with you. We're just, you know, talking.
Oh yeah, no, I'm just trying to clarify.
I take this in a slightly different direction, if I can, Brian. So you asked the question: who is it, the AI or is it the physician? This is a question of who reports to whom, who's in charge, who's at the top. Would you be ever comfortable reporting to an AI as a military person, say, or as a lawyer or anybody like that?
Who, me? No.
Yeah, you. And so the question,
hell no.
That's the question that we're coming to is who should be in charge, and would it be the AI with a person connected to? I don't think they're ever disconnected.
I'm going to just interject that kind of who's making a decision is the insurance companies are already doing this by approving and denying claims. They're using expert systems to do that before human beings get involved when you appeal. So I just want to point out, we're already kind of doing this by proxy.
Absolutely. You get in the elevator and you're trusting the elevonics system in there. So many decision rights are already relinquished to an environment that may or may not have a responsible authority behind it. But we're already making decisions to trust to the agency of the system.
And what people are good
can
at,
always find someone to sue, though. Don't worry.
What people are good at is exceptions. What people are better at currently than machines is handling the edge cases. Okay, should I make an exception in this case? Should I give you a refund? Should I let this one pass? Should I decide this in this way? Most of the cases in the world can be very easily decided.
So today, it turns out that I actually do have another meeting at the top of the hour that it's important for me to get prepared for. So our guest speaker, let's just thank Harvey again. He'll be listening to this, I'm sure. And everything you do, be intentional, folks. And thanks for all the great questions. We will talk to you on our next community call. Cheers.
Okay, thank you. Have a good day,
everyone.